Phlebotomy. It's a strange word, isn't it? It comes from the Greek. Leave it to the Greeks. Phlebo meaning veins, and tomy meaning to cut. Now, the history of it is so interesting. There were some pretty scary, crude things that used to be done. In fact, some cultures even believed that draining the blood from people would help ease and get rid of bad spirits. And that would be their phlebotomy. Also, they used to literally cut into the vein and drain it out to look at it. Today, thank goodness, we have a little bit better technique and procedures. Now, there's a simple incision of a vein for the purpose of collecting a small sample of blood for laboratory testing. That's the nowadays description of phlebotomy. Really, what we're doing is we are using usually vacutainers, a vacuumed little tube, and a needle to remove a small sampling of blood. And with that, there are three things that we do. They can be used for diagnostic purposes, such as what's wrong? I'm not feeling well, or this is going on with me. So they may draw a lab, do phlebotomy to find out what's wrong. It can be used for therapeutic assessments, such as which drug is best. And it can be used to monitor health status. Is the drug we're doing working? Also, besides blood, you can also collect urine, stool, and sputum. Now, phlebotomists can operate clinically, technically, or clerical functions. Main thing, though, is to get accurate, safe, reliable collections of specimens and to transport those high-quality specimens to the lab for analysis. Now, more often you're seeing some point-of-care testing. These would be like fingerstick blood sugars, fecal occult blood testing, urine dipsticks, that kind of a thing. Testing that can be done almost basically right at the bedside. Others must be drawn and taken to the lab. Now, the workflow pathway of clinical laboratories basically is there's pre-examination, which would be your pre-analytical, your examination, which would be the analytical phase, and the post-examination, which is the post-analytical phase. So, the one that phlebotomists are most concerned with and most focus on is the pre-analytical. This is going into the room, explaining the procedure, using your universal precautions, and drawing the blood, ensuring the the patient's safety. After you've explained everything to them, making sure they're okay then, and then labeling, doing anything you need to do to that blood before you get it to the laboratory, and then good, safe, swift transportation of that sample to the laboratory.